I need to be right close to deal with that wounded Marine, and I need an entire team. Now that team can be 3 people, it can be 10, it can be 6 or more, or even less. But I need those right there, and we need to be right there so we can stop hemorrhage. So you have to have not just me, but the right team close to the front. And that's difficult to do. Easy to say, it's always been a goal, and this team shows in black and white. Boom, here we are. Call the phone, here comes the United States Navy, here comes the Army, here comes the Marines, 911 for the world, and 911 is trauma surgeons for the battlefield.
The shock trauma platoon is able to provide infrastructure, so they provide the tents that we use, the power that we require. They provide their innate ability for a Role 1 resuscitative capacity.
To you it's chaotic, but for us, it's just we're in the situation, and for us it's just everything is just flowing, and it feels so slow. Like I'm not moving fast enough. You know, sometimes I feel like I'm not doing all that I can, even though to you guys it looks like, oh my God, they're doing this and we're doing this. It's just so slow, I can't even explain it. It's just like a rush.
They're all young, thin athletes.
Working together with them, we have that surgical capability for the most critical patients can go into surgery, while we have the other patients who can maybe wait longer. We're trying to extend their time until they can get to surgery if they need it.
While they get him hooked up on the monitor, I need a blood pressure on him.
Hey, just junction off blood pressure.
We've learned time and time again when time is critical, and that's just not a buzz phrase that we all like to say, but if you are in a severe state of shock, if you're bleeding severely, or if you have many other problems, the ability to have a surgeon, an operative team, remember, this isn't just the surgeon, I'm just one small piece of the pie, and if that corpsman, if that emergency physician isn't doing their job, if that anesthesiologist, I can't do mine. This is a brilliant idea, and I think this idea, whoever the folks who thought outside of the box saw a need for a highly maneuverable team that could be modular, coupled together, and go anywhere in rapid movement, rapid time. We're very forward thinkers, and this unit can serve many purposes. We have no idea the scenarios. We met the STP crew 12 hours before, and all of a sudden leadership just starts throwing us, and bring it on, bring it on. And anybody with a modicum of intelligence can just watch, look at this, 5 seriously wounded patients, and look, it's looked like they've been working together forever. So it's difficult just to come together in a modular fashion, but we show, and you just observe how smoothly it can function.
So what does a penetrating
It's a tremendous honor and a privilege to work with this team. As trauma surgeons, as health caregivers, as doctors and nurses, I think most of us join this profession to care for the wounded, and there's nothing more important than dealing with that wounded soldier, sailor, Marine, our human being. That's what we're here for.